Well, our biggest worry at the moment is actually staffing, and we're seeing that in terms of increased staff sickness rates. And there's simple measures which could be done. In fact, we've written to the UK Health Security Agency an open letter asking for an upgrade in their outdated PPE to provide FP3 masks, which are better protection than is currently available. The kind of standard surgical mask that you're seeing on camera there wouldn't be acceptable on a German bus. You would use an FP2 mask. And, given those staff sickness rates, we are worried as we go into the new year how we're going to manage. And that is, causing a lot of stress amongst staff in all groups, not just doctors, but nursing staff as well.
OK, let's break this down. So staff sickness, this is staff in the hospitals who are actually getting COVID.
Well, for COVID and non-COVID related reasons, and that's certainly the case at the moment in London, which is very much the epicenter of the Omicron situation at the moment. And in fact, overnight, I just had an email from a colleague of mine. You were mentioning earlier about the problems in terms of pilots and less flights. Okay, got staff trying to fly back, who won't be at work next week, basically because their flights have been delayed. So it's affecting every single piece of the puzzle.
Do you have any figures on how many members of staff are isolating? I'm assuming that's what they're doing. If they've got COVID-19 or they can't come to work, if they're ill with something else. Do you have any figures of how many staff can't come to work?
I can't give that figure off the top of my head from my own trust, for example. But, we're definitely seeing that within London and elsewhere, basically. And, we were already seeing that within Birmingham, where I work, basically. It is a big issue. And we know also, in terms of ITU staff, our staffing levels are not the same as they were a year ago. And that, when we talk about bed numbers and things, it's actually, you need to understand the staff numbers as much as anything, actually.
What staff, sorry, was that? I didn't catch that.
In terms of critical care staff.
Mm-hmm. So now if you look at the staffing levels and the issues surrounding staffing levels that you have at the moment, and you compare them to, say, January this year, how do they compare?
When I speak to my colleagues in critical care, they all tell me they've got less nursing staff than they had 12 months ago.
And when you look at the data that Boris Johnson was presented with around the Omicron variant, this wasn't included, was it, the staff shortages?
No, but I think it's interesting. Each of the different parts of the UK are doing things differently, and presumably they're looking at exactly the same data sets. I think that speaks volumes.
Right. So, OK, so let's look at what he was presented with: case rates, hospitalizations, how sick people are, how long they are staying in hospital with Omicron. Do you think if there were new restrictions in England, it would have an effect on the staff shortages that you're seeing?
Well, we are where we are. These are decisions which should have been made a couple of weeks ago. And, I suppose what we in the Doctors Association are worried about our members right now. There's many things we don't know about Omicron, okay? But there's things we do know, and we knew it's more transmissible. So it logically makes sense to update the PPE guidance because we know COVID is airborne, and to provide better protections for staff to reduce staff sickness rates. It's that simple.
OK. Dr. David Nicholl, we're going to leave it there, but thank you for talking to us.
Thank you.